You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on this week's episode of Simple Health Radio. Today I'll talk about a case of a young boy I saw about 2 weeks ago in the emergency department. His name was Alberto. Alberto was a healthy, young 4-year-old boy. He was brought in by his parents on a Tuesday morning because overnight his right eye had swollen shut. They were not sure what happened. He was fine when he went to bed, but he woke up with this impressive swelling and redness. He had no pain. He was not crying, but he was a little bit upset that he couldn't see out of his right eye. The parents gave him a dose of Benadryl. They called the pediatrician, but the pediatrician said, you need to go to the emergency room right away, and that's when I met them at that time. Now, I have to ask additional questions always, because that's what we do as doctors. We try to go backwards. Whenever we can't figure out an obvious cause as to what may have occurred, he denied any injury. The parents stated there was no fall. He wasn't putting any chemicals or creams or anything on his eye, and they really couldn't figure out what happened. So then I asked questions about what he did 3 or 4 days before this event, and that's when I realized what had actually occurred. So Alberto had actually gone to the beach on Saturday evening, and he was there with his friends and family, and they had started a campfire. There were mosquitoes on the beach, and several of them bit him on the arms and legs, but one of them actually bit him right above the eyelid. The parents were not concerned, and they stayed the weekend at the beach house before coming back on Monday morning, and when he went to bed on Monday night, overnight it worsened, and that's what developed into the Tuesday morning eye swelling. Now, he was diagnosed with periorbital cellulitis. So periorbital cellulitis is what we're going to talk about today. Basically, the periorbital region is a large area that's around the eye socket, which includes the eyelids and a little bit of the bone structure around it as well. In children, there are several things that work against them whenever there are insect bites or any type of injuries. Basically, what happens is their skin is very, very sensitive. So even young children, for example, 4 months old, 6 months old, or even up to a year old, if they have any simple insect bite like a mosquito or simple flea bites, they actually develop welts. And the reason is their immune system is so immature, it doesn't quite know how to handle it. Now, in older children, their body is a little more durable. So they may be even stung by a bee, or they may be stung by some other flying insects, and they'll have a very mild reaction and that can disappear. But the exception is the face. The face is very vascular, meaning there's a lot of blood circulation. There's a lot of soft tissue, for example, along the cheek region, over the forehead. There's a lot of soft areas that can actually swell very, very rapidly. And that's exactly what happened to Alberto. Because he had a mosquito bite on the eyelid, he was scratching it constantly. And that scratching caused the reaction to worsen. Ultimately, what developed is that he had an infection. There was some bacteria. I'm not quite sure which one it was, but I suspect it was either staph or strep or something similar to that, and that became involved in the eyelid infection, which rapidly worsened overnight. The periorbital cellulitis refers to that infection. Now, cellulitis is different than a boil or an abscess in a couple of different ways. So with a boil or an abscess, you're going to have pus that you can actually see. Sometimes there'll be a head, and you can try to squeeze it, or you can see where the source of entry may have been. With cellulitis, it's the opposite. So it doesn't really raise above the skin very much, but it swells, and it causes redness over a larger area. So it spreads underneath the skin. There's no specific head, and there's no way to drain the pus. So cellulitis involves the soft tissue. Now, in this case, because the eyelids were involved, the eyelids don't really have any bones. There's no limiting factors. So when the swelling begins, there's nothing to stop it. They can swell 3 or 4 times the normal amount in just a few hours, and that's because of the inflammation that's involved in that region. Now, the cellulitis may or may not lead to fever, but it can cause a lot of itching and pain. There are people who will try Benadryl, as this family did, but it was already too late for that, because it wasn't technically an allergic reaction anymore. It was an active bacterial infection. Now, in the case of Alberto, we did some basic testing. We did a CAT scan of his sinuses and facial region. Everything was normal. There was no signs of any broken bones. We also did some basic blood testing, but it was all normal, which means the white count was low enough that the infection had not spread into his bloodstream. It was still localized towards the face and the periorbital region, but he did require urgent treatment, otherwise it would worsen rapidly. Now, in children, we have a couple of different ways to treat it. There are several antibiotics that are safe. All antibiotics in children are dosed based on weight. Now, in his case, because it had rapidly worsened overnight, I decided to give him an injection of antibiotics. In his case, it was Rocephin, which is similar to a cephalosporin. It's a cousin of penicillin, and it works well against strep, staph, E. coli, and other related bacteria. The oral antibiotics are commonly going to be amoxicillin, augmentin. Sometimes we'll use Bactrim or clindamycin. These are all different types of bacterial or antibacterial medications that work for certain bacteria. So the goal is to treat with the most likely causative agent first. If that doesn't work, then we add another agent or we modify our treatment based on that. Now, I did call Alberto's family a couple of days later, and he was doing well. The swelling had rapidly reduced within 24 hours. He never spiked a fever. The parents were monitoring him at home. He was taking a bath, playful, and still watching his iPad with his one good eye. But my understanding is that he improved rapidly back to his normal level, and he never had any problems after that time. Hopefully in the future, he won't have any issues, but I advise the family, just always be extra careful whenever you go to any public event, or if there's mosquitoes or other flying insects around your house. You should always use insect repellent, for children especially, because the risk of periorbital cellulitis is very, very high. Now, in his case, he didn't have any long-term issues, and I don't think he'll have any problems, but if it does become an issue chronically, then I would refer him out to a specialist for additional testing. So I do hope you learned some information about periorbital cellulitis. I hope that you can recognize some of the signs and symptoms, and if you or any of your family members have that, go right away to your urgent care, ER, or family practice doctor. Let them examine you, do some basic testing, including lab work or a CAT scan if needed, and get you on the right antibiotics as soon as possible. Hopefully with treatment, it will not cause any major issues, and you'll be healthy again after that. You can follow us on Facebook. We have an active following with several hundred members. Send us your pictures or experiences with periorbital cellulitis, and we can discuss that online on social media. If you have any other resources or other ideas, we always welcome your feedback as well. And I look forward to having you on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.